Ever feel like choosing a toothpaste is more confusing than it should be? Whitening, cavity fighting, sensitivity relief? It's a lot to handle. But here's the thing, choosing the right toothpaste can actually change your dental health more than you'd think. And as a dentist myself, I've seen it with my patients firsthand. Most people pick a toothpaste by what sounds good on the label, or they just pick the cheapest one they can find on the shelves. But are you sure it's what your teeth really need? In today's video, I'm going to break down exactly how to choose the right toothpaste to keep your smile healthy, bright, and protected from any dental issues like cavities, erosion, and tooth sensitivity. So, if you've ever wondered what all these choices mean, or if you're unknowingly using a toothpaste that could actually be doing more harm than good, keep watching. I promise you, you'll leave knowing exactly what to pick on your next shopping trip. And don't miss my number one tip at the end that could change the way you brush for good. First up, fluoride. This mineral is one of the best defenses against tooth decay. Without it, you leave your enamel unprotected, which can lead to serious dental issues over time. Fluoride essentially strengthens your enamel and helps repair early signs of decay. Fluoride actually remineralizes your enamel, and throughout the day, the acids from food and drink erode the enamel layer. Fluoride acts as a shield, absorbing into the weakened areas of your enamel and creating a protective barrier. So every time you use fluoride toothpaste, you're giving your enamel an extra layer of defense against acid damage, helping to keep your teeth strong. So if you're not using a fluoride toothpaste, you're skipping one of the easiest ways to protect your teeth long term. And you might know there's a trend now around natural or fluoride-free toothpaste. While some of these options might feel less processed, remember that fluoride has been proven safe and effective through years of research. And if you're concerned about fluoride for any reason, stay tuned because I'll be discussing some fluoride-free options. Here's an interesting fact. Did you know that fluoride use reduces cavities by about 25% in a lifetime? So, how do I know if my toothpaste contains fluoride? Look for words like stannous fluoride or sodium fluoride in the ingredients. And aim around 1450 ppm for adults, as that's the recommended amount to keep your teeth protected. Whitening toothpaste is everywhere, promising you a bright, pearly smile. But here's the catch. Most whitening toothpastes work by removing surface stains through mild abrasives, not by actually changing the color of your enamel. If you're a heavy coffee or tea drinker, whitening toothpaste can help reduce surface stains. But if you're looking for a dramatic difference, you'd need professional whitening. Be cautious though, as too much abrasiveness can wear down your enamel over time. Think of it like using sandpaper on wood. Over time, the abrasive particles can wear down your enamel, especially if you brush aggressively or use it too often. And once enamel is worn away, it doesn't grow back, which can actually make teeth more prone to stains, sensitivity, and tooth decay. Whitening toothpaste is safe to use a few times a week, but if you have sensitive teeth, I'd recommend being careful. The abrasives in some whitening toothpastes can increase that sensitivity. And if that's you, keep watching, because I have a better solution coming right up. Ever wince when you drink something cold or hot? Or maybe you felt a ting with sweet foods? That's a sign of tooth sensitivity, which happens when the protective enamel has worn down or when your gums have receded, exposing the softer dentin beneath. Sensitivity toothpaste works by blocking those tiny channels in your dentin called tubules that lead to nerves inside your tooth. When these pathways are blocked, it prevents sensations like cold, heat, or pressure from reaching the nerve, giving you some much needed relief. When choosing a toothpaste for sensitivity, look for active ingredients like potassium nitrate or stannous fluoride. These ingredients are scientifically proven to help reduce sensitivity. Potassium nitrate works by calming down the nerve within the tooth, while stannous fluoride not only helps with sensitivity, but also strengthens enamel and protects against cavities. With regular use, these ingredients build up a protective layer, helping to keep those sensitivity triggers at bay. Just remember, as always, consistency is the key, as these ingredients need time to build up to be effective. Sensitive toothpaste is ideal if you have exposed roots, thin enamel, or if you recently had dental procedures like whitening that might have temporarily increased sensitivity. But it's important to remember that sensitivity toothpaste isn't an instant fix. It can take up to a few weeks to see real relief. For best results, use it consistently every day and avoid rinsing with water immediately after brushing. This helps the active ingredients to stay on your teeth longer, giving them more time to penetrate and provide lasting relief. If your sensitivity persists after a month of use, make sure to check in with your dentist, as it could indicate a more serious issue like tooth decay or gum disease that needs addressing. Specialty toothpastes like charcoal, herbal, or fluoride-free options are getting a lot of attention lately. Many people like these because they feel natural or innovative, but it's essential to look beyond the marketing. Often, these alternatives don't provide the same level of protection as traditional fluoride toothpaste, which is key for preventing cavities and strengthening enamel. Charcoal toothpastes, in particular, are highly abrasive. Although they might make teeth look cleaner initially, this roughness can gradually wear down your enamel, and once enamel wears down, it doesn't regenerate, leaving your teeth more vulnerable to sensitivity and decay than it was before. Other specialty toothpastes, like baking soda blends, may also be abrasive, so using them daily could be too harsh. These may seem appealing for a quick polish, but over time, they can actually be doing more harm than good if not used carefully. Fluoride-free toothpaste is another option that appeals to people looking for a natural alternative, but fluoride is one of the most effective ways to avoid tooth decay and protect enamel, and using fluoride-free toothpaste puts you at a greater risk of cavities. If you're thinking about using a specialty toothpaste, first check the ingredients. Make sure it contains fluoride if you want that cavity protection, and if it's charcoal or abrasive paste, consider using it sparingly, maybe just once a week, to limit potential enamel damage. Specialty toothpastes can have a place in your routine, but it's important to balance them with more protective options that keep your teeth safe and healthy. So, choosing the toothpaste doesn't have to be overwhelming. Start with the fluoride paste, add a sensitivity or whitening option if needed, and go easy on the trends, please. And my final tip, do not rinse with water after brushing. Give the fluoride time to work on your enamel. Now that you know exactly what toothpaste to look for, you're ready to make the best choice for your smile. If you found this video helpful, make sure to hit that like button, subscribe for more tips, and let me know in the comments if there's a toothpaste type that you're curious about. And now that you know how to pick the perfect toothpaste for your teeth, the next step is brushing correctly. I covered some surprising tips and common mistakes in my other video, so if you're ready to level up your brushing game, go check it out right here. It will show you how to get the most out of every brush and keep your smile healthy for life. See you there.